Edutainment Studios welcomes you to Managing Gout, Getting Relief. This module is part 1 of a 3-part series on getting relief by managing your gout. Gout is characterized by sudden, severe attacks of pain, redness, and tenderness in joints. Often the joint is at the base of the big toe. Gout, being a complex form of arthritis, can affect anyone. Men are more likely to get gout, but women become increasingly susceptible to gout after menopause. An attack of gout can occur suddenly, often waking you up in the middle of the night with the sensation that your big toe is on fire. The affected joint is hot, swollen, and so tender that even the weight of the sheet on it may seem intolerable. Fortunately, gout is treatable, and there are ways to reduce the risk that gout will recur. In this course, the objective is to help you define the basic information about gout and identify the symptoms and stages of gout. Gout is a type of arthritis that is caused when uric acid builds up in the blood. Uric acid is a normal type of waste that the body makes when it breaks down purines. The blood carries it to the kidneys where it leaves the body in urine. Although purines are chemicals that the body makes, they can also be found in certain foods like meat and seafood. Normally, uric acid travels to the kidneys and leaves the body through urine. This keeps uric acid levels within a healthy range. An overage of uric acid can build up and form sharp, needle-like crystals that clump together in the joints and trigger the pain and swelling of a gout attack. Your first gout attack usually happens in the joint of your big toe. You can also have gout in other parts of your feet, or your ankles, knees, fingers, hands, wrists, and elbows. A gout attack could be triggered by an illness or injury, start suddenly, and often is initiated during the night. Symptoms of gout include pain, stiffness, swelling, joint redness, and feeling warm to the touch. Symptoms start to get better after a few days and are usually gone in 7 to 10 days. The doctor can prescribe medicine to ease symptoms of an attack, but it is important for you to notify your doctor as soon as it starts. Attacks can happen again in the future, but it can be weeks, months, or years before you have another one. There are 4 stages of gout, based on the symptoms you are having and your uric acid levels. In stage 1, you are not showing any symptoms, but a blood test would show uric acid levels are high and crystals are starting to form on the joint. Stage 2 is called a gout attack or acute gout. You may have severe symptoms of gout that get worse within 8 to 12 hours. Symptoms start to ease after a few days and are usually gone in 7 to 10 days. Stage 3 is referred to as interval gout. This is the time between attacks. You will probably not have any pain, but uric acid levels still could be high, and ongoing swelling might be damaging your joints. You must work with your doctor during this time to lower your uric acid and help prevent attacks. In stage 4, you have chronic gout, which means you have had high uric acid levels for many years. You may have attacks more often, and the pain may not go away after an attack. You may also have permanent joint damage. This stage can be prevented by working with the doctor and following the treatment plan. If you have had gout for many years, you may develop bumps under the skin called tophi from a buildup of uric acid crystals. Gout can also increase your risk of other types of arthritis, as well as kidney stones caused by a buildup of uric acid in your kidneys. Please feel free to investigate these other sites for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 1 of this 3-part series on managing your gout, and come back for part 2.